I now call upon Dr. Catherine Duggan, Chief Executive Officer, International Pharmaceutical Federation.
Thank you so much. Distinguished colleagues, partners and friends, it is a true honour to join you today at the launch of Digital Health Without Borders, a landmark movement that boldly calls on all of us to ensure equitable digital healthcare for all by 2028, as we prepare to mark 50 years since Alma Ata. I'm very proud to be here representing the International Pharmaceutical Federation, FIP, the global voice for over 4 million pharmacists, pharmaceutical scientists and pharmacy educators worldwide. I have many of my colleagues in the room with me today. And we were in Astana in 2018, the 40th anniversary of the Alma Ata, where we signed pharmacists up to play our role in delivering universal health coverage through primary health care. Today, I stand here with a simple but powerful message. Health must not stop at borders, and neither should pharmacy. Yet, as we meet here today, 4.5 billion people remain digitally disconnected. We saw that on the maps earlier. Disconnected from the benefits of modern healthcare technologies, as the WHO has highlighted. This movement, Digital Health Without Borders, is exactly the call to action we need to close that gap. It reminds us that technology is only meaningful if it reaches the people who need it most, safely, equitably, universally. Pharmacists are on the front lines of this transformation. Today, they are extending care beyond physical walls through virtual consultations, remote medication therapy management, and telepharmacy services, making care more accessible and more personalised, especially in our communities and communities that have been underserved. This is not anecdotal. We have strong evidence that this works. In a randomised control trial, pharmacists-led telehealth services for patients with diabetes and depression, and this led to 14% improvement in cardiovascular medication adherence, 26% improvement in antidepressant medication adherence, and an overall 14% improvement in medication adherence over 6 months. In another published survey, mobile health interventions for kidney transplant recipients achieved a 61% reduction in medication errors and a significant drop in hospitalisation and serious adverse events. These are just 2 examples of how pharmacists, when empowered by digital health, are improving outcomes, preventing harm, and saving lives. And this is why FIP urges our governments and health leaders to invest in digital technologies that support pharmacists to help us deliver healthcare that is safer, more effective and more accurate, no matter where that patient is. At FIP, we have made digital health a top strategic priority through our development goal number 20. And we have equipped our global members with policy frameworks, digital health competency standards, digital events and training resources to advance digital practice. We have also established the FIP Technology Advisory Group to explore emerging solutions like AI, robotic processes, automation, and real-world data use. Our multinational needs assessment on digital health has identified global priorities and challenges. These have included the need to close the digital literacy gap amongst healthcare professionals and patients, the absence of governance and data protection frameworks, and inequities in digital access, particularly in low-resource settings. So FIP is responding by developing global competency frameworks, advancing education and training, supporting pharmacists to safely adopt digital tools in collaboration with other healthcare professionals, because we can go fast alone, but we can go further together. I'm also pleased to share that FIP is developing a landmark global situation report on pharmacy. We set to release this later this year, but one of the dedicated chapters will explore the transformative role of digital health in reshaping pharmacy practice and enhancing access, efficiency and quality in health systems globally. Stay tuned for this report. We've left a postcard on your seat, so you will definitely know where to find us. The report itself will provide further evidence and tools for policymakers, healthcare leaders and patient advocates to advance digital health transformation globally. Today's launch of the Geneva Declaration of Responsibility reminds us that closing the digital divide requires shared accountability from policymakers, practitioners and global organisations alike. And as we collectively shape the future of health, I invite you to reflect on two critical questions. How can we empower pharmacists to provide cross-border digital pharmaceutical care while ensuring our patients are safe, have data privacy and professional accountability? And what governance and investment frameworks are needed to equip the pharmacy workforce to deliver equitable, digitally enabled care across all our communities, especially in underserved regions. So we call upon you all, WHO, governments, health leaders, allies, partners and friends, to recognise pharmacists as essential digital health providers integrated into national and global strategies. Invest in digital health infrastructure, ensuring pharmacists are fully equipped to deliver care across your borders. Support the digital upskilling of the pharmacy workforce, preparing them to leverage technology safely and effectively. Establish governance and data protection policies that safeguard our patients' privacy and build trust in digital services. And foster interprofessional and cross-border collaboration to make digital health truly inclusive and accessible to all. Colleagues, digital health must be just, universal and borderless. Let us seize this opportunity to ensure no patient is left behind, no community is excluded, and that every person can access the pharmaceutical care they deserve wherever they are in the world. Please know you have pharmacy and pharmacists by your side, shoulder to shoulder in this endeavour. So together, let's make digital health without borders a reality by 2028 and beyond. Thank you.
Thank you so much, Catherine. And I think with pharmacists taking the frontal roles, we should be in a position to provide digital health without borders and digitally in the pharmacies, in the community